The most exciting drugs I think that are coming through are obviously Lenalidomide as a maintenance continuous therapy, which we hope we'll have access to in the UK at some point within the next year or two. Carfilzomib is the next generation proteasome inhibitor, also looks very exciting. But probably the most exciting drug at the moment is daratumamab, which is a monoclonal antibody therapy. We do have access at the moment in the UK as a single agent in relapsed disease, but it's looking most promising when it's used in combination with other drugs. And the data is really very, very exciting using that monoclonal antibody therapy. In myeloma, there's been an explosion of new drugs over the last 10 to 15 years, and it's very exciting. And at this meeting, there's been reports of new combinations, so Carfilzomib with Lenalidomide and dexamethasone, with incredibly impressive response rates, including very deep responses. There's been further presentations on use of consolidation and maintenance as well, and it seems that continuous therapy is definitely the way forward at the moment.